Welcome to our channel. Today we're diving into an important topic, squamous cell carcinoma. Now, I know carcinoma sounds scary, and it can be. It's the second most common type of skin cancer. But like most health concerns, knowledge is power. We're going to break it down in a way that's easy to understand. We'll cover its symptoms, because knowing what to look for is often the first step in getting treatment early. We'll also talk about what causes it so you can take steps to protect yourself. And of course, we'll discuss treatment options and the different types of squamous cell carcinoma. Remember, this video is for informational purposes only and not a substitute for professional medical advice. So how does squamous cell carcinoma actually show up? What should you be looking for? Well, it usually appears on areas that get a lot of sun exposure, like your face, ears, neck, lips, and the backs of your hands. One of the most common signs is a sore that just won't heal or heals and then comes back. You might also notice scaly red patches, kind of like eczema, but rougher and persisting for a longer time. Keep an eye out for any unusual growths too. These could be raised with a central depression, kind of like a tiny volcano. Sometimes these growths can bleed easily, even with minor scratches or bumps. And this is important. Squamous cell carcinoma can sometimes present as a wart-like growth or even a non-healing sore in your mouth. So, if you have any persistent sores or growths, especially in sun-exposed areas, don't ignore them. Get it checked out by a doctor just to be safe. Early detection is key when it comes to treating squamous cell carcinoma effectively. Now, let's talk about what causes squamous cell carcinoma. The biggest culprit is ultraviolet UV radiation, which comes from the sun and tanning beds. Years of sun exposure can damage your skin cells' DNA, increasing your risk. But it's not just the sun. People with fair skin, light hair, and blue or green eyes are more susceptible to sun damage and therefore at a higher risk. If you have a history of severe sunburns, especially early in life, your risk also goes up. And remember how I mentioned it can develop in sores that don't heal. That's because conditions that weaken your immune system, like HIV or certain medications, can also increase your risk. Interestingly, infection with certain types of the human papillomavirus, HPV, is also linked to squamous cell carcinoma, particularly those affecting the mucous membranes. It's important to remember that not everyone who is exposed to these risk factors will develop squamous cell carcinoma. These are just factors that can increase your chances. The good news is that if caught early, squamous cell carcinoma is highly treatable. The treatment plan depends on the size, location, and stage of the cancer, as well as your overall health. One common approach is surgical removal, where the cancerous tissue and a small margin of surrounding healthy tissue are excised. This can be done in a doctor's office or hospital, depending on the size and location. Another option is radiation therapy, which uses high-energy rays to destroy cancer cells. This is often used when the cancer is in a location that makes surgery difficult. For smaller or less invasive cancers, topical medications like creams or gels containing chemotherapy drugs or immune-boosting agents might be used. Your doctor might also recommend a procedure called Mohs surgery, which is a highly specialized technique that removes the cancer layer by layer while examining each layer under a microscope. This ensures that all cancerous cells are removed while minimizing damage to surrounding healthy tissue. Remember, it's crucial to discuss all treatment options with your doctor to determine the best course of action for your individual case. Squamous cell carcinoma can be categorized into different types based on where it develops in the body. The most common type is cutaneous squamous cell carcinoma, which affects the skin. Mucosal squamous cell carcinoma, on the other hand, develops in the mucous membranes that line your mouth, nose, throat, lungs, and other organs. These can be trickier to spot because they often resemble common mouth sores or other benign conditions. There's also a type that affects the nail bed, called squamous cell carcinoma of the nail unit. This often presents as a persistent sore or growth around the nail and can sometimes be mistaken for a fungal infection. It's important to note that while most squamous cell carcinomas are localized, meaning they haven't spread beyond the original site, in some cases they can metastasize or spread to other parts of the body. This is why early detection and treatment are so crucial. The earlier it's caught, the better the chances of successful treatment in preventing its spread. Thanks for watching. I hope this video gave you a better understanding of squamous cell carcinoma, from its symptoms and causes to the different treatment options available. Remember, knowledge is power when it comes to your health. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel for more informative videos on various health topics. And as always, if you have any concerns about your health, please consult a healthcare professional for personalized advice. Stay informed and take care.